Hi guys, good morning, good afternoon, wherever and whenever you're seeing this. I'm going to break down some terminologies or some things you hear when you visit your gynecologist, and it can feel like they are speaking gibberish or it's just a new language entirely. Now, let's break down some common terms in a way that is going to make sense to you when next you visit your gynecologist. So, number one is going to be the amniotic fluid. Have you visited your doctor when you're pregnant and they are talking, oh, the amniotic fluid is small, is big, is that? So, the fluid called amniotic is a water-like fluid that is surrounding your baby in the womb. It keeps them cozy, it makes them safe. It's like a cushion for your baby in the womb. Another thing you will be hearing is the cervix, is the cervix, is the cervix. Now, from your vagina, we have the cervix. The cervix is just like an opening of your uterus, that is your womb, to the vagina. Is the lower part of your uterus. Is like a doorway to the. So it's going to be shut off when you're pregnant. When you're pregnant, it's not meant to be open. And that's why some people that have threatening abortion, the first thing they check is if their cervix, that means the cover, the thing that the padlock to their womb, if it is working as it should. In the labor room, we usually hear, oh, she's 10 cm dilated, she's 8 cm dilated, she's not fully dilated, she's not even dilating at all. Do we even know what dilation is? You know, when something is opening, like you can even say dial. That is when this padlock starts opening. And the time that your padlock's supposed to open is when you are in labor, a true labor. That is when your baby have reached the time for your baby to be born. So when the cervix, that is your door, when it opens during labor to let your baby out, that's like your gates have opened. You have pressed the remote and your baby now wants to come out. That is dilation. It starts opening little by little, small, little by little, with everything, if everything okay. Next one I want to talk about is a big thing. And when you hear that some people have fertility issues, you can see this as part of the reason why some women can have fertility issues. And this is called endometriosis. Endometriosis, anything you say that is cyst, it means that there's something going on in that place and the body is trying to, no. But in this endometriosis case is when the tissue in the lining of your womb grows outside of it. And it can cause pain and it can cause fertility. And sometimes when people are having sex or they're having copulation or they're having intimacy and they start feeling pain also, they need to check it. Provided your man cucumber is not like too big or is being rough on you. Sorry. So another thing is going to be follicle. We're going to talk about follicle. Follicle is like that sac in your ovary. You know, the ovary is the place that holds, so is that tiny sac in the ovary that holds your egg. That is your egg, that the man's sperm. So, an egg before it's released during ovulation. So, that egg that you have grown like a chicken. And now, you have like you have, the egg is out. So, that is now something we hold it in place. And it will be waiting to be released when you are ovulating. And I hope we understand what ovulation also means. So another thing, which is going to be the last one I'm going to say today, gestational age. Like when you talk about gestation, that is pregnancy. Gestational age now is how old is your pregnancy. And this is counted in weeks. We have this conception, oh, it's 9 months. Yeah, people say 9 months. But when you count it in weeks, you're going to be surprised that it is almost 10 months if you count it in weeks. So that is why it is counted in weeks. And that is why your doctor will give you plus or minus 2 weeks. So if your term and you waited for 2 weeks and nothing happened, you just have to hospital. No, I'm not going to end it. I'm going to end it here. There's something we call pap smell. A lot of women are always afraid to go for pap smell just because they feel the instrument that they're going to use is going to be painful. They are shy, they don't want to open everything. My dear, who are you? Please open. Let them check that thing. Let them check that thing, because this test is going to check your cervical cells for anything that is abnormal. So it's like a health checkup for your cervix. You know that opening, that your gates that is locking everything. Yeah. So if you don't check it, you won't know when something is wrong. Please, before I get to understand and before I enter into the profession, I used to be very scared. I can't open my thing. But my dear, it saves a lot of women it's all this screening is just for early diagnosis, prevention, and treatments. So please, pap smell is very important. If you've not done it, call up your doctor today and go check yourself. I'm supposed to be talking about ultrasound, but I'm not going to talk about it because we all know what ultrasound is. But if you don't know what it is, you can comment below and I will make an explanation of that. But 30% of women, ladies, I'm not talking about girls, even girls, they do ultrasound. Babies, they do ultrasound. So I'm sure we all know what ultrasound is. Are you going to be going for your pap smell test? Do you understand most of it now? Are you going to ask more questions? Out of all of this, which one surprised you the most? Comments below and let's get this learning together. No one is an island. If you think you need to tell us more about it, comments below. Thank you.